There are literally kilometers of blood vessels within your eyeballs. Take a look at my little eye model. The blue vessels are arteries, the red are veins, and all day long, those arteries and veins are delivering energy and taking away waste from your very metabolically active eyeball because it's giving rise to vision for you all day long. What happens when one of those veins gets blocked? Today on All About Eyeballs, I'm going to talk to you about a branch retinal vein occlusion. I'm Dr. Mike Vernon. Explaining the symptoms of a branch retinal vein occlusion is pretty straightforward. If you have a blocked vein in the back of your eye, you're not going to experience any pain or discomfort. Now, you may experience some blurring or distortion out of one eye, and it may come on gradually, and it may come on quite all of a sudden. However, you may not have any blurring or distortion at all. Now, whether you're symptomatic or asymptomatic, I'm going to know that you have a branch retinal vein occlusion by simply looking in the back of your eye through a dilated pupil. The evidence of a blocked vein in the back of one's eye is really easy to see. Before I show you what the evidence of a branch retinal vein occlusion looks like, let's go over some anatomy really quick. Blood is delivered to the eyeball through the central retinal artery with all its nutrition and oxygen. It's right through the center of the optic nerve head, and it branches and branches and branches, and all that blood and nutrition is delivered throughout the whole eyeball. Then the venous system needs to collect all that blood and deliver the deoxygenated blood out, collecting, and converging onto the central retinal vein through the center of the optic nerve head, and then that blood leaves that way. When one of the branches of the retinal veins gets blocked, the pressure upstream within the veins is going to go up. And within this section right here, that blood within the veins is going to start leaking out and collecting in these little spots or blots of hemorrhaging. And this section is also going to swell. I had a patient that had a blockage in a retinal vein right there just this past week, and I'm going to show you what her pictures looks like. Here are the retinal photos I took. Her right eye's on the left, her left eye's on the right. You can see in the right eye, the blockage has caused blood to leak out of the veins and collect in the retina and causing that section of the retina to swell. The gray circle represents her macula, the specialized portion of the retina that gives rise to nice, clear, colorful central vision. You can see that the blood and swelling has also collected in that area, and my patient was symptomatic. She complained of slightly blurry vision in the weeks before her exam, and I measured her vision best corrected at 20/30. So why does one get a vein occlusion within the retina? The main causes are high blood pressure, diabetes, arteriosclerosis or hardening of the arteries, and high cholesterol. If you have some of these conditions, first we need to manage those so that we can continue with other treatment options for a vein occlusion. Oftentimes, though, there isn't any reason at all for a vein occlusion. At any rate, there are other treatments to consider once everything else is well managed. Patients that have had a vein occlusion and have macular edema or at risk of having macular edema, they need to be treated. That edema needs to be reduced by an ophthalmologist delivering injections straight into the eyeball or placing inside the eyeball steroid medicine. Lasers used to be used more frequently to treat the macular edema, but they're now used more as a second-line therapy. The injections and the steroids placed directly into the eyeball are more effective treatments these days. Hey, there are two more things we need to talk about. Following a vein occlusion in your eye, your retina is wanting more oxygen than it's getting. So in response, it may start growing new blood vessels. It's called neovascularization. Now you may think, hey, that's a good thing. I'm getting more blood to where it's lacking in the retina. However, these new blood vessels are fragile, and if they start to develop, they're at risk of breaking. And if they break, they can fill portions or the entirety of the inside of your eyeball with blood. So every month you need to go back and see your doctor to get your retinas checked for new blood vessel growth. If new blood vessel growth is observed, that can be treated with a laser, and the laser is applied to the area of the retina around the new blood vessel growth to try to shrink it or eliminate it so that the risk of having blood fill your eye is mitigated. And finally, go out and enjoy life. If you have macular edema, your ophthalmologist is regularly seeing you to give you the treatment necessary to help it resolve. And your optometrist or ophthalmologist is seeing you every 30 days to make sure that no new blood vessels are forming in the back of your eye. You're doing everything you can to ensure the best outcome, even if the vision in that eye that was affected doesn't get back to exactly the way it was before. Have you ever had a branch retinal vein occlusion? Tell me about it in the comments below, or ask a question. I'd love to respond. And one last thing, thank you for your eyeballs.